So today we're going to be rating medical specialties. This is obviously my own opinion, and don't get offended because I know there are some doctors out there that cannot take a joke. Don't be one of those guys, okay? Hopefully, this video will help someone in the future pick a specialty, or it's going to help me pick a specialty since I myself haven't chosen a specific specialty. So if I do rate some specialty that you love low, do not take it too hard, too much, okay? So let's kick it off with internal medicine. Internal medicine is kind of good for people that just can't seem to pick a medical specialty. They kind of like every part of every single medical specialty. I'm going to rate internal medicine a B, and I'm going to explain myself. I'm going to rate internal medicine a B just because you're a jack of all trades, but you're a master of none, right? That's the only reason why I'm going to put internal medicine B, but I think it's a good specialty. Okay, and next comes neurology. Well, yeah, neurology will also get a B. Fun fact, I actually worked as a nurse in a neurology emergency department. Shout out to all the neurologists out there. It was, I wouldn't say it was difficult. I really had a good time when I worked there, but some of the patients were really difficult because they have bad outcomes, and some of the patients get agitated in the hospital, and you have to take control of that situation, which is sometimes not always a very pretty process. So yeah, just because I had a good time working in neurology, I'm going to also put neurology in the B tier, although I'm not really a big fan of neurology per se. Next is dermatology. Dermatology is actually a favorite specialty for a lot of people out there, but for me, dermatology is also one of those specialties that I just don't seem to understand. I just don't understand when I read dermatology. So yeah, I can't seem to differentiate the skin diseases and all that stuff, and that really annoys me. So I'm going to put dermatology in C tier. I'm going to hurt a lot of people there, but according to me, dermatology is C tier. Obs and gyne comes next. Well, there's actually a time that I wanted, like strongly was considering this specialty because it's a pretty interesting specialty, especially everything that's related to childbirth, to pregnancy. It was very intriguing, and I found it was very simple to understand. It wasn't really that difficult compared to specialties like neurology, for example. For me, neurology is it's just difficult. But obs and gyne, I'm going to give obs and gyne. I'm going to put obs and gyne in the A tier. A tier. Next comes cardiology, I guess. I'm going to have to guess the medical specialties according to the photos that I downloaded about 2 weeks ago. So that in itself is a challenge, but I hope I don't mess anything up. Okay, so this one, it's most definitely cardiology. Cardiology is actually a very good specialty. It's a very interesting specialty, and I understand cardiology a lot. Some people find difficulties in understanding cardiology, but for me, cardiology is a pretty good specialty. And I remember there is a period that I was very, very interested in interventional cardiology. I even shadowed a doctor a couple of times, an interventional cardiologist. It's pretty futuristic. It's very interesting, that part of cardiology, but something that deterred me from interventional cardiology was the risk of radiation. I did read a couple of articles and saw a couple of videos that were talking about the doctors getting cancer later in life and stuff like that. And that kind of scared me a bit. But according to me, cardiology, especially interventional cardiology, is somewhere there in S tier. Okay, radiology. Radiology comes next, and I think radiology is a very good specialty for introverts, people that really don't want to talk to patients, but they still want to be involved in patient care, but not directly, right? They enjoy sitting in a dark room and looking at these pictures. So according to me, radiology is A tier. Let's put it in A tier. Radiology is A tier, but but I'm thinking of it right now. If AI is going to encroach into the medical field, I think radiology is one of the first specialties to be affected. So because of that, it really doesn't sound future proof, right? So I'm going to put radiology somewhere in the B tier. That's fair enough, I guess. Okay, next comes gastroenterology. Yeah, I'm going to be honest about this one. Gastroenterology is not my favorite. So I'm gonna put gastroenterology in D tier. I don't see myself being a gastroenterologist in any I don't see myself becoming a gastroenterologist. Next is this should be geriatrics. To be honest, I don't know anything about geriatrics. It's not a it's not a very common specialty in Russia. Not a lot of people want to become geriatricians, right? So uh, just because I don't know anything about this specialty, I'm going to put it in the D tier. And which one is this one? I can't remember. I'm going to have to skip that one. Okay, I'm gonna skip that one and we'll see later. Next comes endocrinology. Endocrinology is, yeah, it's not difficult, but yeah, I think I'm going to put endocrinology together with dermatology in the C tier. You will find later, though, in the video that I am a bit biased. I think I favor more procedural specialties. So that's why maybe I'm putting some of these specialties in, in the C and B tier, whilst most people would put them in A or S tier. Psychiatry, I guess. Psychiatry. Mm, too much talking for me, I guess. Too much talking. I wouldn't want to be talking and talking and talking. So psychiatry, yeah, psychiatry will have to be D tier for me too. Too much talking and dealing with agitated patients. I know it is a good skill that every doctor should have, but for me, psychiatry is D tier. It's also very difficult, in my opinion. In my opinion, I remember reading psychiatry and it was just difficult. Okay, next comes urology. Yeah, I'm going to rate urology as S tier. S tier, yeah. I have been contemplating on picking urology. I find it very interesting. So I'm going to put urology in S tier. And urology is very procedural. As I said, I have a bias towards procedural specialties. And so that's why urology is in S tier. Plastic surgery. Yeah, I also wanted to become a plastic surgeon at some point in medical school. And I think I'm not against the thought of becoming a plastic surgeon. I think it's a cool specialty. I'm going to put, yeah, let's put it at A tier. It's not really S tier for me, but we can put it at S tier. Okay. Okay. Yeah, let me just put these ones later because this one I don't remember which one this one is. I know this one, but I don't really know what to say about it. So next comes orthopedics. Mm, yeah, I'm going to put orthopedics in S tier. I don't know if it's the gym rat in me, but something just tells me that orthopedics is going to be interesting. And it's also procedural, so that bias again, right? And it's pretty simple, right? It's in terms of understanding the concepts of orthopedics, as far as I can understand. Of course, I've never worked in the orthopedics department. I only had a cycle and it wasn't even that long. So yeah, in my opinion, orthopedics is also a good specialty. They also improve patients' quality of life like significantly when they change their joints. So it's a good specialty. Yeah, and next comes emergency medicine. I'm going to put emergency medicine. Actually, I'm going to put emergency medicine in A tier. Emergency medicine is, I think every doctor should have some experience with emergency medicine because it builds that confidence in you. You feel like a doctor because, like in any situation, you can do something to help a patient, right? Especially in emergency situations. Like imagine you're in a plane, right, and you don't know anything about emergency medicine. It's going to be difficult to raise your hand when the stewardess comes and says, do we have a doctor in the airplane? But if you've worked in emergency medicine, you can confidently raise up your hand, and most probably you'll be able to help the patient with something at least. So I think emergency medicine is a pretty good specialty. I do think that the hours, though, people that work in emergency medicine do have crazy hours. So yeah, for that reason, it becomes 80. Okay, which one is this one? Pretty obvious, right? Ophthalmology. Ophthalmology is a specialty that I've also been looking into. I saw uh, some of the operations that they do in ophthalmology. They look pretty interesting. However, the anatomy of the eye is something that I find challenging, and it's so small. I don't know if I'll be able to uh, do those kind of operations. But yeah, I'm going to put ophthalmology in 8. Yeah. The problem is with some of these specialties, and I guess people that did medicine or someone in med school understand me here. Sometimes you really don't have that mm, experience in a field for you to make a decision, right? For me, I remember ophthalmology, we had a cycle, or in some places they call it rotation, right? And it was, I think, 2 weeks, 2 weeks to a month. It wasn't a lot. And it was during COVID, so we couldn't actually see a lot of patients at that time. So it's pretty difficult to make decisions in some of these specialties. But according to me, ophthalmology is 80. Yeah, rheumatology is going to be somewhere together with dermatology in C tier. C tier. Why? Yeah, some of these specialties, just because, just because rheumatology is going to be in C tier, just because, right? Which one is this one? This one must be oncology, and oncology is going to be somewhere there in D tier too. Why? I can even explain this one. So, when choosing a medical specialty, right, it's something that you're going to do the greater part of your life. Most people are at work most of the time, and oncology is a very emotionally draining specialty, in my opinion, because most patients, uh, at least the greater part of the patients that you see, they don't have positive outcomes. And this could be specifically draining. So, shout out to all the oncologists out there. But yeah, I don't know if I have the emotional fortitude to deal with these kind of things. I don't want to go and see a patient and inform them about their prognosis, about their diagnosis, and start crying, right? That would be very, that would be very pathetic, right? Okay, so I think oncology is for the strong at heart, and I guess I'm not one of those guys. So I'm gonna put oncology in D tier. Yeah. So next comes intensive care. Intensive care is going to be in. I'm gonna put intensive care in B tier. Why? I find it again, the working hours could be tough. Again, same thing with oncology. You have a lot of patients that might have a bad prognosis, and this could be emotionally draining, morally draining. So I'm going to put it in B tier. I'm not going to put it in D tier because it's actually procedural. It's something like emergency medicine, but on steroids. So I'm going to put it in B tier. Okay, the next one must be immunology and allergy. Yeah, this one is one of those specialties that are just going to go in D tier just because. Most of the specialties that are in D tier is because I don't understand the specialties, or except for oncology, which is emotionally draining for me. Okay, this one is sports medicine. I could see myself doing sports medicine. I am someone that likes sports a lot, and being able to travel maybe with a team of athletes to go somewhere, taking care of them, taking their vitals, seeing how their recovery is going and stuff like that. That could be something that I would see myself doing. It's interesting. I would put it in. Yeah, let's put it in next year. Yeah. Next comes proctology. Proctology. Yeah, this one is those ones that are going to come into D tier, well, just because, right? As I said, when you're choosing a medical specialty, it's something that you're going to have to do for the greater part of your life. And proctologists are doctors that look into people's butts. So that is not something that I would want to do for the rest of my life. Although I did put urology in S tier. It's pretty funny, right? I put urology in S tier, but I decided to put proctology in D tier. Yeah. Well, I don't know. The idea of just looking into people's butts is not something that I like. But looking at people's genitalia, as you can see, is not a bad thing, I guess. Next comes neurosurgery. It is a procedural specialty, and it's a very competitive specialty. Actually, a lot of people want to become neurosurgeons. Neurosurgery. Again, neurosurgery has a lot to do with the nervous system, and as you can see from, if you've been watching the video from the start, uh, neurology and the nervous system, I'm not a big fan of them. So yeah, I'm going to put neurosurgery together with neurology in B tier. I think that's fair enough. Next comes cardiothoracic surgery. I remember before I got into medical school, when anyone asked me what type of doctor do you want to become, I always said, yeah, I want to become a cardiosurgeon. I want to do operations on the heart. But now that's not something I would want to do. I don't know why, but it's just something I would want to do. So I'm going to put cardiothoracic surgery. The work hours are pretty bad, I guess. It is a very difficult job. Imagine operating on the heart, but we'll have a good challenge. I'm going to put cardiothoracic surgery in A tier. I wouldn't see myself doing cardiothoracic surgery, but I would appreciate why people love cardiothoracic surgery. So yeah, I'll put that in A tier. Next comes anesthesiology. Anesthesiology is obviously anesthesiology is S tier. Of course, it's S tier. For the greater part of medical school, I wanted to become an anesthesiologist. So anesthesiology is still an S tier specialty for me, although it's not as clear now that I want to become an anesthesiologist because I have these other specialties that I'm actually interested in. But it's still S tier for me. Next comes ENT. ENT. This is also a popular specialty. A lot of people have ENT, but again, I am not most people, right? So I'm going to put ENT in. Yeah, this is something I would also not see myself doing, but I don't think it's as bad as proctology, right? So I'm going to put it in the C tier. Okay. Next comes vascular surgery. pretty interesting specialty also, in my opinion. I can see myself being being a vascular surgeon, and it's pretty procedural. Don't have much experience in terms of doing any rotations in vascular surgery. I've seen patients with vascular problems, but yeah, I'm going to put vascular surgery in hmm, A, B. Yeah, I'm going to put it in A tier. I'm going to put it in A tier. Next comes hematology. Hematology is one of those specialties that's also difficult. Hematology and neurology gave me a very, very difficult time in med school. One of those specialties that just wanted me to quit. So because of that, I'm going to put it in D tier. Payback time. Payback time. Next comes pediatrics. Again, pediatrics, I have almost zero experience with pediatrics because the thing is, here in Russia, to become a pediatrician in Russia, you have to, while others are doing med school for 6 years, if you want to become a pediatrician, you have to go into pediatric school for 6 years. And when you graduate, you are a pediatrician, right? And mostly people that do med school here in Russia, they cannot become a pediatrician. You get what I'm saying, right? Usually, doctors that finished med school here in Russia deal with patients from 18 years and above, while pediatricians that finished pediatric school deal with patients from 17 years and below. After graduating pediatric school here in Russia, you can specialize in any specialty that you want. So you can do uh, cardiology, but for kids, you can do cardiology, you can do oncology for kids, you can do any other specialty, but for kids. I don't know if that's a good thing or it's a bad thing, but that's just how the system works here in Russia. So I do not have a lot of experience. So because of that, let's just go out on a whim and say, I'm going to guess this one. It's going to be B tier. Let's just put it on B tier. Okay, pathology. Yeah, yeah, pathology is going to be D tier. It's not something I can see myself doing, but it's a good specialty, I guess, for those people that don't want to be directly involved with patient care, but they still want to be involved. So you can become a pathologist. It's almost like a radiologist, right? If AI is going to take over medicine, I think radiology will go first, and second will be pathology. So yeah, because of this also, I'm going to put it in detail. Okay. Mommy, oh, okay. So this one is oral and maxillary surgery. Yeah, this one is going to be, where is ENT? I think I can put it in the same area with ENT. Yep. There you go. Don't have a lot of experience again. You see, it's a big trend, right? Most of these specialties, you don't have a lot of experience in the field for you to make a very strong decision, to have very strong feelings with them. But you have to work with what you have, right? Okay, so this one must be general surgery. Yeah, general surgery is something, I don't know. I don't think I'll see myself doing general surgery, but it's a good specialty for anyone that wants to be a surgeon, I guess. But yeah, I think I'll put general surgery in B tier too. B tier. Okay. I don't know what this photo is. I don't know if it's supposed to be here even. What could this be? What could this be? What could this be? Physiotherapy. A physiotherapist doctor. So I don't think it's mandatory to become a doctor for you to become a physiotherapist. A physiotherapist. Let's see about it. Yeah, it's not mandatory. It's not a specialty, right? I don't know why I've got it here. So yeah, this one is, yeah. Let's remove it. Can we remove it? No, we can't. Okay, then we're gonna leave it there. We're just gonna leave it there. Physiotherapists are wonderful people, actually. I guess they have good work hours. Okay, so according to my list, let's go over my list here, my tier list. So according to me, so this is my final tier list of medical specialties. And according to me, in my opinion, S tier specialties include cardiology, urology, orthopedics, sports medicine, and anesthesiology. It's a pretty good list, right? I know a lot of people will not agree with my list, but according to me, these are very good specialties. And it's something that I would see myself doing in the future. I obviously do not know what the future holds, but for now, these are my S tier specialties. Honorable mentions, of course, go to obs and gyn. I find it very interesting. I'm still considering it. It's somewhere between S and A tier. Plastic surgery. Basically, any specialty that's in A tier is a specialty that I can see myself doing later in the future. So basically, these boom 11 specialties. I really like these 11 specialties. That will be cardiology, urology, orthopedics, sports medicine, anesthesiology, obs and gyn, plastic surgery, emergency medicine. I don't know about emergency medicine though. I don't know about that one. But yeah, let's leave it there for now. Ophthalmology, cardiothoracic surgery, and vascular surgery. These are pretty good specialties according to me. Okay. Okay, guys. This Okay, guys, that's how I would rate these medical specialties. According to me, of course, I do appreciate that a lot of people will have different opinions to the opinions that I had here. It would be interesting to know what you guys would say. Which one is your favorite specialty? Which specialty would you have put in S and A tier, and which specialty would you most definitely put in D tier? Because yeah, these specialties that I put in D tier are pretty solid D tier specialties for me. I wouldn't see myself doing any of these specialties, but I appreciate that a lot of people like these specialties, especially psychiatry. I know a lot of people that want to become psychiatrists in the future, and they completely love psychiatry. But for me, it's not for me, right? Okay, guys, we've come to the end of the video. Please like the video, subscribe to the channel, and all that other good stuff. Okay, see you in the next video. Peace.